Joining us now, Dr. Omar Latif. He is the CEO of Rush University Medical Center, a large hospital in Chicago, which is on the front lines of battling the coronavirus. Dr. Latif, thank you for being on our show. How is your hospital in terms of being prepared for this? Do you have everything you need?
Well, thank you for having me. I think our hospital has been working very diligently over the last 2 weeks in terms of preparing, learning from lessons in other countries in the world and other healthcare systems. We've developed a unique approach of trying to flip our hospital so that we have a forward triage area where we can really isolate patients with suspected infections, put them in a special area in our hospital, both in the emergency room and then a unique area of the hospital that we are walling off to the rest of the system that can take care of just coronavirus patients. So to the extent that I can tell you that we recognize the importance of isolation, ensuring that we have the right number of beds, ensuring that we're working with the city and state, which have been amazing to get the number of supplies that we need. We feel right now that we are prepared, but we're only prepared for numbers that we're currently seeing. And we are anxious, as the rest of the country is, for the potential to overwhelm the system.
Doctor, would it be a relief to you if the government was setting up military hospitals, specific coronavirus care centers?
I think in the end, having the right number of beds and the right number of ICU beds available for patients in this country will be related to the number of people that continue to get infected. So it will absolutely be a relief if we get to numbers that overwhelm our system. Where I am cautiously optimistic is the ability of the United States of America to clamp down and contain and mitigate the increasing volume or the surge of infection numbers that we're seeing. To the extent that that's possible, our healthcare system is remarkable in this country, and we will be able to adapt to an extent. But certainly, if our numbers continue to increase and we don't contain, and as a society we don't mitigate the course of this spread, then we won't have enough beds and we will need extra beds.
Katty Kay.
Dr. Latif, what's the time frame for you for understanding whether your optimism that we can mitigate those new infections is borne out? Are you looking, if we speak to you in 4 or 5 days' time and the numbers are still going up, will you say we've lost control of that moment when we could have brought the numbers down?
I think at the end of the day, no one will critique us as a nation if we over-prepare. We're hearing this from national experts, local experts. I think that time is today. I think the time today is to prepare, regardless of where the numbers may be, to use predictive analytics and the knowledge from what's happened to other countries and say the numbers are going to overwhelm the system. So let us prepare our healthcare system locally, nationally, to take larger numbers and create the number of beds to offset this increase. So I would say the time is actually now, regardless of what the numbers are going to be, to prepare for the worst case scenario. History will look back on this and say, if we have too many beds, so what? If we didn't have enough beds, people could actually die.
Doctor, how are we making sure that people in underserved areas of Chicago, underserved areas around the domain that you work, are actually served and tested and included in what you're trying to achieve there?
So Rush University Medical Center is open to our community. We believe we serve the west side of Chicago. We have many initiatives that include community activities. Our doors are open to those people that come in, to everybody in our community. We built a forward triage area just to care for people, and anybody who comes in is going to be treated the same way. We believe strongly in equity and care, and that'll flow through in the way we do our daily business along with our coronavirus approach.
Dr. Omar Latif, thank you very much for coming on the show this morning. Good luck as we all work through this together. Up next, while the president insists his administration has tremendous control, the Washington Post reports the administration's struggle to mitigate the coronavirus outbreak has been marked by infighting and blame shifting, misinformation and missteps, and a slow recognition of danger. We'll dig into what's driving the White House response next. And this news, as we go to break, the Pentagon informed congressional lawmakers on Friday that there are currently no coronavirus tests available for troops in Afghanistan. Coalition troops have no access to tests, but if they have symptoms or believe they are at risk, they are able to report to sick call and receive on-base medical care, which includes a screening and a medical diagnosis. If they are suspected of carrying coronavirus, doctors on the base will send samples to testing facilities in Germany.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.